This is organized by the Rush MS Center, and it's a true pleasure and honor to introduce a wonderful team that we have for you today. And this is going to be an ongoing series for the month of June, July, and August. So with us today, we have Jennifer Bertrelli and Laura Morris, and I'm going to let you guys introduce yourself and tell us a little bit about what you do. But also we have Adrian Castillo here. Adrian, as you guys know, is a nurse practitioner that she's been a Rush for over 30 years, and she runs the Brain Health Clinic. And of course, as usual, we have Katie McGrath and Kathy Kiefer. So a wonderful team that we have today for you. And hopefully you enjoy the meeting. I'm going to be logging out of the meeting in a few minutes because I double booked myself. But I leave you in good hands. And without further ado, I would like to now pass the baton to Jennifer and Laura. Thank you for being here.
Thank you, Dr. Mervale. We're really excited to be here. So, as Dr. Mervale mentioned, we're going to be doing the first of a three-part series today on nutrition and the mind diet. We'll be giving you a little scientific background on nutrition and MS and getting into the science and some application behind the mind diet. And we'll dive into that. But first, I'll tell you a little bit about myself, and then I'll turn it over to Laura. So my name is Jennifer Ventrelli. I'm an assistant professor in the departments of preventive and family medicine at Rush University Medical Center. And I'm a registered dietitian. So my passion is to take things like the mind diet and help people apply it in their life. How do we actually do this in real life? And so hopefully today we'll show you some tips and tricks how to do that. And I'll pass it to Laura.
Awesome. Thank you, Jen. I am Laura Morris. I have co-written 2 books on the mind diet. The first one was Diet for the Mind, which I wrote with Dr. Martha Claire Morris, who was the original researcher and lead creator of the mind diet. She also was my mother. So the mind diet is very close to me in many ways. She unfortunately passed in 2020. And Jen and I had the privilege to work with Jen and bring her on to help us write a second book highlighting how people can really follow this fantastic diet to help save their brain or help their brain from dementia and other neurodegenerative diseases. So I am a personal trainer, a nutrition consultant, and a professionally trained chef. So I love food. I love everything about it. And I love helping people find their way to love it and incorporate it into their life. So we're looking forward to showing you guys some fun things.
Yes, absolutely. All right. Well, before we get into the fun stuff, I'm going to do my fun stuff, which I think is also the fun part, and that's the background and the science. So I'm going to share a little bit, some PowerPoint slides with you.
And as Jennifer is perhaps getting things ready, we do want to make sure that anybody puts any questions into the Q&A box. And we will pause periodically throughout or even towards the end to make sure that we answer any of those questions. I just wanted to sorry for the interruption there, but I do want to make sure the crowd knows that please feel free to put any questions in the Q&A. The chat
yeah,
box.
That's great. Kathy, thanks for saying that. We also plan to leave some time at the end exclusively for a Q&A, so we'll be collecting those.
Thanks.
So as we mentioned, we're going to be doing 3 parts to this series. Today we'll focus mostly on an introduction to the mind diet. There's 15 food groups to the mind diet, and we'll dive into that today. Today we're going to focus mostly on vegetables and fruit. Then in July, we'll talk about healthy proteins, mostly poultry, fish, and seafood. And then in August, we'll talk about what we call quality carbohydrates, beans, legumes, and whole grains. What you'll learn today is that there's also a list of foods that we call moderation foods. And we don't say that you have to completely avoid those foods. Well, we talk about limiting those foods, and we'll be talking about those all throughout the 3 parts. We'll also be talking about some foods that have been shown to be helpful to the brain and to MS all throughout, and those are healthy fats. So tonight, I'll dive a little bit into the science on nutrition and MS. As I mentioned, I'll give you an intro to the Mind Diet. And then I want to introduce a tool. We'll also give you a link to our website that has a bunch of free tools that you're welcome to download. We're going to highlight one of those just because we have a limited time with you. That is for meal planning, how to meal plan one meal. And we'll try to go through that with you not only tonight, but in the other two cooking demos that we do with you as well. Then I'll turn it over to Laura for the real fun stuff, the hands-on cooking piece, and then we'll leave time for some Q&A. So let's dive a little bit deeper into the science here. If you haven't been able to take advantage of the 3-week brain health program with Dr. Mervalli and the rest of his team, I highly recommend that. We were able to get a little picture into the window of some of the clinicians that were able to bring their expertise to that program, and it's a wealth of information. So I'll either refresh for those of you who have seen it or give you a little taste for those of you who haven't. So we know risk factors for multiple sclerosis. Some is genetic and some is environmental. So between 4 to 12% can be biological depending on the family members you may have with MS. Women are more likely than men, more than 2 times more likely. And then I pulled this slide directly from Dr. Miravalli's visuals. We know that there's environmental factors. If you smoke, it highly increases your risk. If you're overweight or obese, it highly increases your risk. And vitamin D deficiency increases your risk. Today, Laura and I are going to stay in our lanes. We're going to be talking about the nutritional environmental factors and talking about what are the things that we call modifiable factors. What can you do? What things can you change? And so just some highlights from the research. We know that if there's vitamin deficiencies, those are some things you can change. The bottom line on this is check with your doctor. No secrets there. See if there are deficiencies there. The science is very clear. If there's deficiencies, there's increased risk for MS relapse, disability, and even lesion load. So please follow your doctor's recommendations. And in order to do that, you've got to go to your doctor's appointments and see what's there, what's happening. Sodium. This is a big thing, and we'll talk more about this as we get into more details about the food. Sodium essentially is just the salt that's in your food. 4.8 grams per day was associated with higher risk for relapse and 3.5 times the risk of new lesions. And I look at that and I think, as someone who maybe doesn't know about sodium in food, like, what does that even mean? How can I put that into usable terms? Think of a teaspoon of salt, 1 teaspoon for those bakers out there. 1 teaspoon has 2,300 milligrams or 2.3 grams. So that's not a lot. In other words, it doesn't take a lot of actual salt to get to the amount of sodium that is already putting you at higher risk for either relapse or making symptoms worse. So it's not just the salt shaker, it's getting sodium from fast food, restaurant food, processed foods. The research also tells us that if you combine sodium with saturated fat, it leads to even worsened clinical outcomes. So that's some of the bad news. But some of the good news is that we know that things like Mediterranean diets can prevent the brain from atrophying or degrading the brain cells, prevent it from quickly aging, and preserve the brain volume. We also know omega-3 fatty acids are associated with greater white matter in the brain. We want a big, voluminous brain. That helps us. We don't want oxidation in the brain. So let's take a moment to think about what oxidation is and what antioxidants do. If you think about a fire burning, this can be good sometimes, right? Think about when we're camping and we're toasting our marshmallows. Fire's like burning, right? And small controlled fires can be good, but when they get out of control, there's destruction. So in the body, some oxidation is normal. In fact, in order for us to have energy, that's what's happening in the body. These small oxidative reactions are happening in the body. But when it becomes excessive, that's oxidative stress. That's a bad thing. And that myelin sheath that gives us our protection on our spinal cord and the optic nerve that's actually protecting us, that is damaging. Oxidation damages that. And so what we want to do is see anything that contributes to advancing that aging and advancing disease and advancing that oxidation. We want to see how we can slow that process down. So antioxidants, the antithesis of that, are things in the body that essentially act like firefighters. They put them out. They control the oxidation and prevent the damage. So the name of the game is, how do we calm the fire? Well, the first thing we need to know are, what are the things that are pro-inflammatory? What are the things that bring the fire up, that make oxidation worse in the body? So the research tells us that saturated fat does that. We get saturated fat from meat products, hydrogenated oils, refined sugars. We get a lot of questions, and this might be more appropriate for our third session, about things like dairy and gluten. We don't know that those are directly connected to MS, but if there's some underlying allergy, dairy allergy, gluten allergy, that's the definition of inflammation. So those are the things that you would want to know if they were there. So what is anti-inflammatory? Well, we've already named vitamin D. We've already named omega-3 fatty acids. We've already said make sure to talk to your doctor in case there's deficiencies there in different vitamins. And then fiber. Fiber is really important, and we get fiber from lots of different sources, both soluble and insoluble, from vegetables, berries, whole grains, beans, and legumes. Also protects the gut microbiome, which again, we're going to talk more about this in our third session in August, that gut-brain barrier is really important in terms of preventing symptoms and exacerbation of symptoms. So I won't lie to you. There is not one single diet that has been shown to be effective to treat MS. What we do know is people who follow low-fat diets, eat high amounts of vegetables, high amounts of fatty fish like salmon and tuna, and then have vitamin E in their diet and eat whole grains, those are the people who have better outcomes. We also know that there's other lifestyle recommendations that we won't be able to get to in this series, but it would be a missed opportunity if we didn't name them, like getting 15 minutes of sun exposure, because your vitamin D actually gets activated in your skin by the sun. Getting physical activity at least 30 minutes most days. Engaging with other people, that stimulates the brain and helps keep the brain healthy. And then, of course, following your doctor's recommendations for your disease-modifying therapies and your medication regimen. And then being kind to yourself. This is that bucket of what I call mindfulness and just keeping track of all of this. It's a lot, right? It's a lot to remember. So this bucket is going to be things that we talk about each time we meet with you, and we're going to keep coming back to these things. This is kind of what I call the baseline of everything, and we're going to be repeating a lot of these things so that you can take little nuggets of them and apply them to what you're doing on a day-to-day basis. So let's go back and try to link this to what this means for brain health and cognitive changes in MS. So again, if you were able to participate in the 3-week program, you may have remembered from Dr. Giorio's presentation that 40 to 65% of people with MS may eventually have their cognition affected in these different areas. So that might sound really depressing. My favorite thing that I heard through all of the presentations were that research is growing in this area, and we're really learning a lot more about how we can prevent decline. And a lot of these statistics are becoming outdated because of everything that we know that we can do and the things that are now under your control. So why wouldn't we choose the things that we know work well and capitalize on those? And this is a really exciting time for nutrition right now, paying attention to what we eat and what makes us feel better as individuals, not as statistics. So with that, I want to introduce something that we've been talking about, we're going to be talking about, and that is the Mind Diet. So this is the other piece that when I said I won't lie to you, there's no single diet for MS. The Mind Diet has not been extensively studied for MS, but what it has been extensively studied for is cognitive decline and prevention of Alzheimer's disease. It's a hybrid between the Mediterranean diet and the DASH diets, which have been extensively studied in all of these different conditions, which lead to oxidative stress and inflammation. So I think those are pretty good odds, and you'll see that the foods include a lot of foods that we've named the nutrients and things that include what we talk about already. I'll show you one study that studied a group of people over 10 years. This comes from the Chicago Health and Aging Project, and they gave these individuals food frequency questionnaires, and they gave them cognitive tests over a span of 10 years. The people who ate the top level of the MIND diet had a cognitive functioning of those compared to those who ate the lowest level 7.5 years younger. Also reduced their risk for Alzheimer's disease by 53%. Now that's pretty impressive, right? Cut their risk in half, more than half. But actually my favorite statistic about this is that even the people who followed it moderately well, like sort of ate well, right, in the middle, reduced their risk by 35%. So what the message here is that you don't have to be perfect in order to get some benefit. And I really love that. The higher mind scores were associated with slower rate of decline in 5 cognitive domains, those same areas that we saw were affected in MS patients. So the recommendation here is to incorporate things that we know have been shown to slow aging of the brain. So let's get to the foods. You might be thinking, okay, Jen, that's nice to hear, all the science in the background, but what do we eat? What are the actual foods? So let's get to it. So here's a brain. These are the 3 that we're going to be focusing on mostly today. Vegetables with an S, and fruit, just single fruit. There's only been one fruit that has been scientifically researched and shown to be protective of the brain, and that's berries. Our leafy greens are going to be most protective. People who ate leafy green vegetables up to 6 times per week were shown to have the cognitive functioning of people 11 years younger than their counterparts. So you want to eat 1 leafy green every day, and then you want to add other colorful vegetable every day. Berries, about 5 servings in a week. Servings only half a cup, so that's pretty easy to get. The other food group that we're going to be incorporating and talking about over the course of our 3 sessions are the healthy fats, monounsaturated and polyunsaturated fats. You'll find those in extra virgin olive oil, mostly monounsaturated. We want 2 tablespoons per day for those. And then nuts and seeds, about 1 ounce, that's about 1/4 cup. You want that about 5 times per week. So those are the ones we're going to be mostly focused on. This is another slide that we'll show you each time, so I'll go more quickly through the other foods. Right now, lean proteins are important, fish and seafood and poultry, healthy carbohydrates, whole grains, beans, and legumes. And then wine was shown in a very small amount to be protective, but we put it as a moderation food because we also know in higher amounts it can be pro-inflammatory and it can be toxic. These are the foods that are shown to accelerate cognitive decline. And they're filled with saturated fat, trans fats, and sugars. Fried food, you don't want to eat that more than once a week. Full fat cheese, this is the one that makes me cry. It's my favorite, 2 times a week. Red meats and processed meats, 3 times a week. Butter, less than once a day. And sweets and sweet drinks, which we'll talk about. So the last thing I'll do before I turn it over to Laura is introduce our tool that we think is going to be helpful for you in terms of planning each meal. We call this the mind plate. And so the idea here is that we want to envision our plate in 3 sections. So if you think of your dinner plate, maybe you're at a picnic, you envision those plates at a picnic that are divided like in 3, and usually the biggest thing that you put in the biggest section is like your meat, right? And then maybe the sides, like side salad, potato salad, things like that. Flip the switch in your brain. Think about filling the biggest section when you're planning your meal. How can I make the biggest portion of my meal vegetables? Maybe a little fruit too, some berries, right? And if you take a look at your fist, put your other fist next to it, that's about the volume that you want, okay? Try to get 2 fists of vegetables at each meal. That's the first step. If you can fill up on those vegetables, then you can get mostly the ability to fill up on those and then sort of embellish with the rest of the categories. A palm of protein, a quarter of the plate with your whole grains, beans, and legumes. And then lastly would be dressing it with your healthy fats, such as olive oil, nuts, seeds, and avocado. So I think I'll pause here because this is a perfect opportunity for Laura to actually illustrate this plate rather than with my little cartoon here with some actual food.
Thank you, Jen. That was fantastic. Excuse me, is there a way I can make my camera bigger just for when I'm demoing food?
Yes, so if you at home, in the upper right-hand corner of your screen, there's three little dots.
Yes.
And you can click on that and you can say
Move to stage.
move to stage. And that will make Laura's window bigger so you can see what she's doing bigger.
So, okay. Oh, okay. All right, perfect. Jen, that was fantastic. I love hearing just all the research that has been coming out and how we, as you said, continue to learn more and more in this field. It just keeps getting updated on ways that we can take care of our brain. It's so cool. So thank you for that. What I am going to start with, we are going to get to that mind plate. We're going to do it with a recipe, some summer taco bowls. But first, I want to talk about what Jen and I kind of think is the most important thing when you're trying to incorporate these foods or eat a little bit better. And it's time management and meal planning. So we can know that we want to get in these foods and like, oh, okay, I have to get in more vegetables. Okay, but how are we actually going to do that? And that is 100% time management. So we actually want to plan when you're going to get these foods in. So this is a great time to look at your calendar. Your calendar with, we have ours in our wallet, so I'm looking over there. The events you have going on in the evening, what you might have during the day, and looking at when you can schedule in your meal prep, your grocery shopping, and your actual meal planning where you're figuring out what you're going to eat each night. So really start by looking at your calendar and be kind to yourself. Take out the word should. I should be cooking more, and do what's realistic and what's going to work for you. Even if it's 1 or 2 meals a week that you're actually cooking, that's fine, starting there. And when for in spirit of today's theme, we're going to focus on the planning for leafy greens, veggies, and berries. So if you're looking at your calendar, just writing in, oh, I'll have a salad for lunch on this day. I'll do, greens in my soup on this day. Just finding those little ways that you can get them in. And start reasonably. If you don't eat any right now, maybe start trying to get in 1 or 2 a week. Start small and build as you get a little bit more comfortable and develop those habits. So once you do that, you have your meal plan written out a little bit more. You have to grocery shop, make a grocery list and shop. So the reason why we want you looking at your calendar is we want you to write in when you're going to grocery shop. That's very important. That takes a couple hours. It doesn't happen magically. I still hope it does every week. Like, oh, I have to go do that. I find it exhausting. This is where I say really take advantage of these modern conveniences we have right now with Instacart, grocery delivery. These are fantastic ways to get food to your home without getting out of the house and taking those hours to do that. So if that's available to you, that is a great option. I love the company Misfit Market. They also go by Imperfect Foods, and you can buy kind of misshapen or off-size produce that would have gone to a landfill at a discounted price. They're perfect and wonderful, and they're delivered to your door. So that's my favorite. I utilize that every week, although I still find myself going to the grocery store. But so that's the next thing you're going to put in your calendar. And then the last thing, and I'll transition into this, is your meal prep. So when are you going to have time? Is it right before the meal, or is it going to be like on a Sunday afternoon? Really writing that also into your calendar, a couple hours for meal prep of washing and chopping and making your sauces, really whatever you have time for and what's realistic for you. So again, I'm going to go back to, you have to curate it for your life, and be kind to yourself. As Jen said, if you don't get to everything, that's okay. You know, but nobody does. I don't feel like I do. I have grand expectations for myself, but I always am like, okay, you know, I didn't get to everything, but I have the plan in there and I've gotten some of it done. So with that being said, again, we're going to focus on leafy greens, berries, and vegetables today. So I'm going to go over a little prep with those on how to store them in your fridge and get them all clean. And then we'll build a mind plate with a recipe from our prep. So we're going to start with berries. I'm excited. It's berry season. I don't know anybody else. Like, I love going to the farmer's market and just staring at them at this time of year. And then we go through them so fast. So this is a really great time to get those berries. We also completely encourage people to do frozen berries if that's easier for you to just have them in the fridge or in the freezer. You know, again, what's going to work for you is what's most important. So I'm going to start with just some strawberries here. I have a clamshell of these, and we highly encourage, if you make time for it, as when you get home from the grocery store, instead of just jamming everything in there, to wash and prep it. So you're saving yourself some time. You're giving your future self a little help there. You know, it's just so much easier when it's just ready to grab and go. So with berries, I'm going to angle my camera down here so we can see a little bit of the prep. They have a very delicate exterior, as you guys know. So I always recommend people not to just dump water on top of them. And the best method is to just have a big bowl of water. This is my salad spinner I'm using. So I have a colander that will fit right in there, but any bowl will do, and any colander. And I'm just going to gently transfer my berries into the colander, and I'm going to submerge them in the water. So this way there's not a lot of direct pressure going to break down those berries, and just gently mix them in there, and it will help all the dirt and any sand or anything like that fall to the bottom. So this is the simplest way. To be honest, this is how I do it, and then we'll take it out and I'll show you what we do after that. Another thing that some people do, if you're worried about pesticides on berries, you can do a teaspoon of baking soda in there and let it sit for about 5 minutes, and then give them a good little shake and pull it out. That's supposed to help eliminate some of the pesticides that sit on more conventional strawberries. If you buy organic, that's less of a concern. And another trick that I see people do to help them last a little bit longer is to do a couple tablespoons of vinegar into your water. And again, let them sit for a couple minutes, give them a little shake, and it will help them just hold their structure and not decompose as much. So this is what I do. I just do it nice and simply, give it a little shake. I can see some dirt in that water. It's just always amazing to me because you never see it on there. I don't know if you guys can see it there, but just little bits of dirt in there. After we do that, you're just going to have a tea towel or paper towels, and you're going to gently lay them out in a single row on the tea towel. And I usually just leave them to air dry while I do the rest of my prep. I kind of put them in a own little spot because you don't want to press on them too much or anything like that. You want to just let them air dry because the water will accelerate the breakdown of the berries. So to keep them fresh for a longer time, you want them as dry as can be. Okay, and then we want to store them in the fridge. So I recommend kind of a more flat, if you have it, container, because you don't want to pile the berries on top of each other. That will smush them together, and again, they'll start breaking down. So we want one thin layer of the berries, and I usually line it with just some paper towel. Again, you can use a tea towel, one you don't mind it will get stained a little bit from berry stains, and just lay them in a flat row so they're not sitting on top of each other. I don't like to cut them until I'm about to eat them, or I just put them out whole because I think they're so pretty. But you can certainly cut them if you want to do that. And then I'll just put another little layer on top. So any excess moisture is going to go into the paper towels. Okay. And then you cover them and we will store that in the fridge. Okay. And you have your berries all ready to go. Washed, grab and eat. Berries, again, this time of year, eat them just how they are. I don't think you need a recipe, but I like to think of them as a little fun garnish on cereals or yogurts or salads. It's a great way to get them in, or just have them on the side of a meal, a good meal. And that's our easiest way to get those in. So that is our berries. That washing technique works for all the berries, all of them there. So the next thing I'm going to move to
Hey, Laura.
yeah.
Sorry to interrupt, but I want to make sure that I answer a question that was put on the chat box directly to me before I log out and go to my next meeting. So I apologize if I interrupt, but I thought it was a perfect time after the berries, okay? And I see that there is a question from Suzanne asking me if there is any correlation between the mind diet and brain reserve. And the question has to do with good, healthy eating help not only with cognition, but also replenish brain reserve. And that is an excellent question. So two things about that. One is, as Jennifer mentioned before, many nutrients in the diet will have antioxidant properties, but also will have anti-inflammatory properties. So the first step in preserving brain reserve and stimulating more brain reserve is stopping any insult or any damage that is currently being active to the brain. And in MS, that's called inflammation. So anything that has anti-inflammatory properties is going to have a benefit in your brain reserve by preserving it and by stopping the process of utilization of the brain reserve to compensate for pathological states. So number one, yes, with anti-inflammatory nutrients, as was discussed today, that's one way. But interestingly, also certain studies, and primarily those were done in Alzheimer's, looking at, for example, nutrients that have a high content of polyphenols, certain leafy greens, and certain berries, for example, and omega-3 fatty acids. Those have been shown to slow down the process of atrophy. So not only you are directly preserving more inflammation, but also you may be impacting in the rate of atrophy. In terms of MS, most of the studies that has been done were, again, with vitamin D, with omega-3 fatty acids, and the polyunsaturated fatty acids, which are the ones in olive oil, in avocado oil, in fish. And studies looked at, for example, whole brain atrophy, but also certain parts of the brain, including the thalamus. And there was a link between high content of those nutrients and a preservation of thalamic atrophy, which is one of the earliest parts of the brain that go through atrophy in MS. So long answer to your question, Suzanne, but yes, eating healthy will give you some benefits. And again, I take this moment to apologize for going to the next meeting, but I leave you in excellent hands. I'm already impressed by what you guys are doing. So I'm very inspired. So thank you for doing this. And I can't wait to listen to the recording. Thank you again.
Thanks for being here.
So interesting. Love listening to all of that. Okay, so I'm going to jump right back in to our leafy greens. So this one is exciting for many reasons. It's kind of a superfood for the brain. It's got its own category. And the thing that I love about it is that they're so accessible. You can find leafy greens at almost any grocery store. And when it comes to prep, they come already prepped. I love buying. This is kind of, we do a mix, but we do a lot of the already washed, ready to eat. So that is your prep. You can just grab one of these, put it in your fridge. If you open it, sometimes I like to put a paper towel or something to help grab any extra moisture so they don't start breaking down. But you guys probably all know these, see them all different kinds of greens. Typically the darker the leafy green, the more nutrients it's going to have. So, but I always tell people, eat what you really like. And if you can find dark ones that you really enjoy, then go for that. But if you love romaine and the lighter ones, then definitely eat those as well. But what about the ones that you don't get in the clamshell? So we're going to prep those. And I'm going to do one for our recipe today. We're having some romaine in our taco bowl. So when we're prepping leafy greens, let me angle you guys down here. There's a way that I like to cut them before I wash them. So they're in good bite-sized pieces. I don't know about you guys, I don't like feeling like a cow when I'm eating my leafy greens with big, huge leaves hanging out of my mouth and dripping on my chin. So I like to cut them in bite-sized pieces so they fit nicely on my fork and they're not gonna, attack my face there. So I'm just gonna cut off the end here, just about 1.5 inches. If the top was wilted, I might cut that off, but that looks great. And then for the romaine and ones that are a little bit longer, I'm gonna cut it lengthwise down the center. So I'm basically cutting it into 4s, and I'm going to rotate it over. Oh, trying to keep it together, and I'm going to cut it again down that way. So now it's in 4s. Okay. And then I'm going to go across and cut it horizontally at about 1-inch pieces. So I'm going to have all these lovely, already small little pieces. This is probably hothouse romaine, so it's not too dirty or sandy. Some of them, I'm sure you guys have gotten them and they're super sandy and buggy. But this will just determine, I don't need to do a lot of washes on this one, but there's 2 main ways I will wash this romaine. So I have a salad spinner where I'll put it in and I will just get a light little spray of cold water going over for a couple minutes and then spin it down, rinse it out, maybe spin it again to help dry it. Or you can do what we did with the berries. And I do this if I have kale that has lots of little sand or bugs in there. I might soak it in a big bowl of water and let all the sand and everything fall to the bottom. And I usually use my hands to get in there. So that's another method. This one is not dirty at all. If I was being really lazy, maybe I wouldn't wash it. I don't know. That would be something, but we'll go ahead and just rinse. I won't demo all of that, but I would just put this in my salad spinner, however you use it, rinse out the water, and have that all ready to go. So to store it, very similar to how we stored the berries. Again, I like a longer container, and I'm going to line it with paper towel so any excess moisture is not going to break down the greens. There's 2 main enemies to greens, and that's heat and acid. So if you're applying heat or acid, it will immediately start breaking down. And that's true with all your green vegetables, actually. Green beans and broccoli and snow peas. So a good recommendation is not to apply your acid or heat until right before you're going to eat it. So with the acid, that's usually salad dressing. So you want to wait until you're going to eat or serve your dressing, your salad, before you add your dressing on top. And if you're going to have something cooked, that you also want to wait till just before you're about to eat them. So you could add another paper towel on top. These are pretty dry. I don't need to, but and just covering it up. And I usually have a whole stack of them in the fridge, even with my clamshells, and that goes in the fridge. And so that's all ready to go. Just grab your little handful and you have those ready to go. So that is our leafy greens. They're super simple to prep, especially when you can just use those conveniences. So the last one I'm going to do is our other vegetables, which is a huge category. So I'm going to focus on the vegetables we're using in today's dish, our taco bowls. And also I encourage people to kind of lean into the season that we have right now, which is summer. And cooking techniques for summer vegetables are fantastic because you really don't need to cook them a lot. They're delicious right off of their vines. Most of the foods you can just eat raw, and I love that. And I really lean into that in the summertime and take advantage of that. So I have a pint here of strawberries. I've already rinsed under the water. And then if I were going to, container. So we're making these for the taco bowl. So for meal prep, if I can, I'm going to combine as much as I can of one meal into one container. I don't like lots of containers. It becomes like Tetris in your refrigerator and all of that. So the more I can condense things and have them all ready to go together, then I suggest doing that. And tomatoes, I like a small serrated knife. And these are just grape tomatoes I'm just going to cut in half. So I'm going to prep them exactly how we're going to throw them in the salad. So that's all ready to go. And you can do this a couple, 2-3 days before you make your salad if you want. You don't want to go too far ahead because they might start getting a little mushy, but certainly they'll be okay after 2-3 days. You can even do this the morning before you might have something. I also encourage people to enlist help from people in your home if you have that availability. Get them involved in the meal prep, helping you out, because it makes it so much easier to get stuff done when you have some help. So there we go. I'm just going to put some of the tomatoes in there. The next thing we're going to have is a pepper. And again, I'm going to cut it in kind of a uniform shape of the other vegetables that we're going to have in this salad. So the salad has corn in it and beans. I just like to cut it in half and then just pull that core out, put it in my compost bowl. So I'm going to cut these peppers to kind of match the size of the beans and the corn. So it makes it easier to take a bite of something. It's not an awkward mouth feel. Everything is kind of uniform. So I'm going to cut them in strips and then cut them into squares. All right, so we're going to go across, and just doesn't have to be perfect. If you have a large pepper, or you're not going to use the whole pepper in the recipe, I suggest just cutting the rest into strips so you have little strips for snack later. I like to use all my extra vegetables to put out on a veggie tray, mainly for my kids. I have 3 kids, and I call it shark hour. Around 4 p.m. they just start circling me in the kitchen like sharks, and I know they're hungry, and if I put out a tray of veggies, they'll eat them up, and it's a great way for them to get in veggies and not fill themselves up. So I like to keep just some extra strips if I can afford it, have some extra. So there's our peppers and tomatoes all cut, ready to go for our taco bowls. And the last one is corn. So I did find some fresh corn in the store. I love fresh if it's seasonal and looks good. I also highly suggest frozen corn. To have just even your freezer is a great thing to pull out and add to soups and stews, and frozen corn works just as well. Just let it defrost on the counter, or you can pop it in the microwave. It comes to room temperature. It works very well. If you can get fresh corn, I love it in the summer, and I love it raw. I don't like to steam it. It is so good and sweet when you can eat raw corn. So a good trick I like with cutting corn, when I see people do this and go down and it's just falling all over the place, and you're trying to gather your corn back in, it gets really messy. So if you hold it down and cut just straight down, so you can get a flat edge on the corn, so then you can just put it down. So now it's nice and flat and stable, and I'm just going to go around and cut the corn with that flat stable as I move it around. And I even love a salad when the corn is still slightly stuck together. I think that just like yummy mouthfeel when you can get something like that. So depending on the ear of corn, you might get a half a cup from one ear of corn. And I think I did pretty good. I got most of it off there. So I have my corn here, and I'm gonna put it in there. So now I have all the veggies I will need for this taco bowl. So for the meal prep, I would just put a lid on this, put it in the fridge. The other ingredients that I prep for it, I would stack with this so they're all together. And I've seen people even put it in baskets. That's very organized, with it labeled with the meal, but again, just making things easier for yourself. Having as much prepped ahead of time is one of the easiest ways to stay on track. So with that, we are going to move to our mind plate. So we have our veggies prepped. I have the other ingredients prepped. Now we're going to build that lined plate. Here on my plate. Here we go, perfect. Okay, so the first thing we're gonna do is Jen said half the plate is leafy greens and vegetables. So we're gonna grab that romaine that we just cut up for our leafy greens. And just for learning purposes, I'm going to actually use a measuring cup, a 1 cup measuring cup, because that's about a serving. And it's a great way to just get an idea of how much a cup is, right? Sometimes we think it's way more or way less than it is. Okay. So that's about a cup. I press it in just lightly, I'm not jamming it in there. And then I'm going to put it on the plate. And so you can see how much space it takes up. Okay. So there's our leafy greens on there. Okay. The next thing I'm going to do is take all those veggies we just prepped and I'm going to put them on top of the leafy greens. Okay, so we're piling them on here. And again, a serving of vegetables is a half a cup. Okay, so I'm going to do just a little mix of all these vegetables we did and make a half cup with a little medley of those peppers and corn and tomatoes. Okay, a little heaping half cup kind of. And I'm just going to pour it right on top. Okay. So there is roughly half our plate of vegetables. Okay. The next thing we're going to do is the quarter of our healthy carbohydrates. So in this recipe, our healthy carbs are two. We have two. I have quinoa and black beans. And we'll share this recipe with everyone so you can have it and make it at home if you'd like. Spoon here. So a serving of grains and of beans are a half cup. If you are being vegetarian, you might do half cup of beans, half cup of quinoa, since we're going to be doing a meat of our lean protein. Otherwise, you're just going to kind of eyeball. It depends on your caloric needs of how much of these you're going to get. Let me get my measuring cup. But I'm going to do just a combined half cup of these two. You certainly could do a cup of each if you wanted a bigger meal, more filling meal. This was going to be a little lighter. You can do that. But we're just going to put that on roughly a quarter of that plate. Okay. And our last thing is going to be our lean protein. So this recipe calls for ground turkey, lean ground turkey that I have seasoned. I have my own seasoning mix I do that I really like. If you buy your own spice mix, that's a great way to make it a little bit faster and easier. Just make sure you look for low sodium because those can be so high in sodium. So looking for ones that say low sodium that still have a good taste is great. So I'm going to do, again, we don't measure. A serving of meat is about 3 to 5 ounces. Again, you don't have to get that at every meal. You could get a half serving at one meal and a half serving at another. I'm just going to kind of fill up this little space with that. So there is 3 of our components, our vegetables, our healthy carbs, and our lean proteins. We're almost done with this plate. The last one, a very important one that Jen had talked about, is our healthy fats. This dish uses a really delicious vinaigrette that I'm going to make for you with extra virgin olive oil, which is something that we recommend people to get in daily. We recommend around 2 tablespoons. You can have that all in one meal, or you could break it up, have 1 tablespoon, a half tablespoon. Don't be strict about it. It's just something to be mindful of as you're learning to incorporate these things. So this vinaigrette has 3 ingredients: lime juice, honey, and oil. And this is a formula I use for almost all of my salad dressings. And it's an acid, a vinegar, and then something to bind it. In this case, it will be honey. Mustard works well, tahini, peanut butter I like using even. You just need a little bit of that binder to help emulsify everything. But the ratio I like to do is 3 to 1. So 3 parts oil to 1 part vinegar. If you can remember that for homemade dressing, you're going to be good. So our vinegar or our acid is lime juice. And I'm going to start just by adding the juice of 1 lime here. You usually get about 1.5 tablespoons, I find, from 1 lime, depending on the size of it. And then I'm going to add about, for one serving, just a teaspoon of honey, not a lot is needed, just right in the center there. Okay. Grab a fork. And then we're going to whisk in, I like to just use a fork, we're going to whisk in the olive oil, and this will help it emulsify, meaning it becomes one, it doesn't stay separated. So the honey helps bind everything, and I'm just eyeballing it, but in our recipe we have specific amounts. And then you get this gorgeous, I just love the color from that lime juice. If you guys can see it, it's nice and bright, a little bit of a green tinge to it. And it's so simple. I highly encourage people to make their own dressings, especially when you're trying to get in good quality oils, because a lot of the bottled salad dressings don't use extra virgin olive oil. They use lots of different seed oils and things like that, and additives and sugar and salt, and they just don't taste as good. So we have our fat. So Jen talked about 1 to 2 thumbs serving size of fat. So we're going to add on 2. We're going to add on the extra virgin olive oil, and then we're going to do some avocado. So we're just going to drizzle on some of that to your liking, you know, make it so it tastes good. You want to really enjoy what you're eating. And then we're going to do a little bit of avocado. Just going to cut it in half here. And again, we say about a thumb size. I always say something like this. It's not the main event. It's more of a garnish. I just like to make little slashes through there, and you can scoop it out with a spoon or a fork. I'm just going to use my fork because I have it here, and just putting it on top there. And these are called taco bowls, not taco plates. So we would mix this all together, and I'm going to do that in just a minute. I wanted to first, while I have this plate here, take a moment to talk about the foods to limit. And I like to use this incident because Jen and I really like to emphasize to replace, instead of eliminate a food to limit, to replace it with something. So this is a great example. If you had a typical taco salad, the meat might be ground beef. So a good replacement, if you're trying to reduce the beef, is to add in ground turkey. For the fats, you've seen we did olive oil and avocado. A typical taco salad might have lots of full fat cheese and sour cream and fried tortilla chips. So these kind of substitutes are great, or even a low fat yogurt would be great in place of sour cream and cheese. And it doesn't really apply to this meal, but vegetables are a great replacement when you're trying to eat a little bit less fried foods. So that is the main components of our mind plate. Make sure you guys can see it there. Okay. And I will turn it over to Jen, and we can go over any questions some people might have. I'll just show you real quick. I'm going to add it to a bowl here. Where's my fork? And mix it all together. The salad is fantastic.
It's gorgeous, Laura, and it's making me hungry at almost 7 p.m. Central Time.
It is. It's dinner time, right? Absolutely.
It sure is.
Yeah.
Thank you for that. And really easy to just slice and put all those things together. Thank you for that beautiful arrangement.
You're welcome.
I couldn't agree more. I'm very hungry right now, and that looks delicious.
It is so good. You know what? And I love my kids eat this, and I can't really get them to eat quinoa, but like something about this, they eat it away. So I'm always really, happy that they're getting that in. So
Yeah, kids definitely like the Mexican type of dishes, so that's definitely a good way to go about things.
yeah.
Katie and I will probably piggyback off of some of these questions that came through, but going back to Jennifer, when you were talking about fruit and you highlighted berries in particular, and so the question that came through was, are other fruits not correlated, not studied, or have any negative association? So if you could maybe talk a little bit about that.
Sure, this is a great question. So, yes, all fruits were studied. So the way that the studies worked is they gave people what are called food frequency questionnaires and asked them everything they were eating. So all the fruits they were eating. I saw that there was another question from Kimberly about watermelon. So that was also asked. And then the cognitive exams were taken, and the determination was which of the foods were correlated with the improvement in cognition or lack of cognitive decline in cognition. And the only association was with berries. The other fruits did not have a negative association. So it doesn't mean that it's harmful to eat other fruits. I don't want to, send a negative message about other fruits. Of course, all fruits are healthy. It's just that the only fruit associated with specifically brain health were berries.
Fantastic. Thank you. Going back here, trying to look at any others.
There was an additional question for Jennifer about potassium chloride as a salt replacement.
Yeah, I saw that too. That is perfectly fine. So this is essentially what you would find in the grocery store as a salt substitute. Those are perfectly fine. They don't have sodium. What I'll say is don't expect it to taste just like salt. But sure, it's an appropriate substitution. The other thing I would say is just make sure that you have no potassium restrictions. Someone who might have a potassium restriction would be if there's any kidney issues in your medical history. Otherwise, it would be perfectly appropriate.
Fantastic. Well, this one might be for Laura. When you were demonstrating with the corn, question came through about any magic cleaning techniques to get the silk out of the corn.
Not really. I don't know. I'm just thinking of how I do it. I haven't heard of any good tricks. That's a good one to kind of look up. I feel like you could probably find a good trick for it, but I usually just pull off as much as I can and then rinse it under water and pull off anything that's left on there. Let the water help kind of pull it off when it's been sticking on there. But if I am going to cook corn, I do like to keep it in the husk, and I might steam it in the microwave or something. And I find once the silks are wet, they do come off easier than when they're a little bit more dry and sticky. Yeah.
Okay, excellent. That's a trick I haven't heard of, so that's actually pretty good.
It is.
Getting the silk off of corn is like one of those universally frustrating things that everyone has to figure out how to deal with.
In my family, the kids had to go do it. I can remember. It's like, take the corn on the back porch. That's the kid job, because probably they didn't want to do it. Yeah.
We had
Be a good trick just to keep the kids busy.
Yeah, it is.
There you go. We had two questions about smoothies. Is it okay for smoothies to contain fresh fruit or frozen fruit or vegetables? And do you think you could get the nutrients needed from a fresh fruit smoothie made with coconut water for a quick breakfast?
Yes. The short answer to that question is yes. So yes, frozen fruit, berries and other fruits should be just as nutritious as fresh. They freeze fruit and vegetables at their height of ripeness. So theoretically, they should be at their height of their nutrition. Sometimes even better, because when you get excited about eating healthy and then you buy all this stuff and then it sits in the fridge and degrades and gets all unnutritious and in your fridge, it may not be healthy after a while. So yes, the short answer to that question is yes. I don't know, Laura, if you have anything else to add to that.
No, I think that's fantastic. I love, and then it adds to like that smoothie feel, right? Where it's a little bit cold and it's kind of a treat. Yeah, I think it's great. Yeah. Yeah.
Question around particular berries. So when we're talking berries, obviously it's a rather large category. Blueberries, strawberries, any in particular that might be a little bit better than others?
Most of the studies were done with strawberries and blueberries, but because they all contain similar nutrients, it's thought that all of the berries are beneficial.
So including raspberries, blackberries. Yeah, fantastic.
we're almost through all the questions I see. The last one I see is more about sort of advice for how to approach introducing this type of mind diet for, perhaps a younger population or children that have a diagnosis of MS, and any tips or tricks for incorporating that easily that you all could maybe rattle off if you have them.
Yeah, I think Jen and I would probably say the same thing. And that's to start with one or two small little goals that you're going to work on. And there's kind of a reason why we started with just focusing on these certain food groups, the leafy greens, vegetables, and berries, because we really encourage people to just pick one or two foods that they're trying to incorporate in, and develop habits that just become routine. And once you feel those are routine, then you can move on to the next food group, which we'll just cover in the next sessions for people to learn more about those. But really starting with small steps and just developing habits to incorporate them in. Jen, do you want to add on to that?
Yeah, I would echo that. As I would say, especially for younger groups and kids, and Laura knows a lot more about this than I do with three little ones at home. But Laura, you alluded to this in your demo. Get them involved,
Yes.
right? Give them a job. Get them excited about it. Let them choose some of the recipe. Let them do a step or two, right? I think getting them interested and getting them interested and involved. The other thing you said that is really powerful, I think, is that the timing of the availability of food. You said, oh, they start to get hungry. You called it shark hour around 3:30, right? So you know that then that's the time you have to have the healthy food out. Like you're capitalizing on those highly vulnerable moments. You know that for them. So they're going to eat what's out.
Yeah.
Uh,
Yeah,
Two things
absolutely.
that stood out to me for younger individuals.
Yeah. Yeah.
For
Especially if you,
older individuals, I'll do that for my husband.
yeah. Yeah, food is community, and I think they want to get involved, they want to help, and the more you have everyone in your household or in your peer group, if you do a lot of meals with them, the more you have everyone participating in it, the much more fluid and easier it will come to everybody. It becomes something everyone does together, which we do either way. If it's junk food or healthy food, we're doing it together, right? So yeah, that's a good question. It's a tricky one, but it can
I
be
think
done.
I know we're over time, but there's a few more questions that just rolled in, so maybe we can address these and then be mindful of everyone's time. First one to either Jess or Laura, or Jen or Laura. How about dried fruits nutritional value compared to frozen or fresh, like dried cranberries? Is there a difference there?
Yeah, we don't count dried fruit. Something about so really it's becomes more concentrated, which means the sugar content increases. Um, and then there's something about, and this is all speculation, right? It could be something about the processing. Laura said this about vegetables. There's two things that is the enemy to vegetables. It's heat and it's acid. So this idea of processing, and when we do something even like dehydrate a fruit, it's processing. So it doesn't act the same in our bodies. So, no, I haven't seen a randomized controlled trial about dried cranberries or dried blueberries, but in this moment, because of the information that we know, we recommend that people stick to the fresh.
Yeah.
Makes sense. And then sort of the last two, and I think this might be a good time to get Adrian involved here. Just asking about, knowing nutrition early on, or perhaps being in the know of it before even getting diagnosed with MS. Does that impact someone's journey with MS, or how does, comorbidity like diabetes impact that sort of disease progression? Oh, Adrian, I think you're on mute.
There we go.
There you go.
Well, hi. I do believe that treating multiple sclerosis involves having a lot of tools in your toolbox. So it's not just about getting on the right disease modifying treatment, but it also involves things that you can control, which are lifestyle factors and healthy nutrition being one of them. So could it have helped your MS 4 years ago if you knew about this information 4 years ago? Yes, but also from a historical point of view, brain health in regards to MS is starting to become more and more talked about now. And remember, 4 years ago, we were still dealing with COVID. And so I think now is the time to, now that you're in the know, it's the time to adapt a healthy lifestyle so that you can add a tool to your toolbox and how you approach treating MS.
I'm looking through my personal Q&A and I don't see any other questions. I don't know if you guys see any popping up on your chat, but we might have covered them all.
We're pretty good too.
All righty.
Well,
Well,
go ahead, Katie.
Jennifer and Laura, thank you so much again. For everyone that's still on the call, this, like we've said before, this is going to be a 3-part series this summer. So July and August will also be covering the MIND diet. And I believe you said it's going to be protein in July and then what in August?
Healthy carbohydrates.
Healthy carbs. So each month we will send out the new updated link so you guys can all attend. Someone did ask if these were going to be recorded, and they are, and they'll be on YouTube. I'll send out, I believe Jennifer and Laura supplied me with the recipe itself, so I can send that out to everyone afterwards as well. And if anyone else has anything else to add, I think we are adjourned.
I just wanted to remind anyone on the webinar that you can make an appointment to see me on a one-to-one basis in regards to brain health and assessing lifestyle in order to come up with individualized treatment plans. My visits typically are 1 hour long and can be done virtual and in person. So feel free to call the clinic to make an appointment. Hope to see you soon.
Yep. And I will include Adrian's contact information in the email I sent out and how to schedule with her. So, alrighty.
Fantastic. Well, a huge thank you, both Laura and Jennifer. Great start to our summer series. So super excited to hear you next month. And I think this was really great. Thank you.
Thank you guys so much. That was wonderful. And we appreciate all the questions and the opportunity to share this with everybody. So thank you guys. Yeah. We'll see you next month.
Thanks for having us.
Thank you.
Bye.